Good morning, everyone. Sorry we're getting a little bit of a late start. We were just waiting to make sure everyone had the opportunity to register. So my name is Lori Meeks. I am the director of the School of Religion here at USC, and it's my pleasure to welcome you all today to this two-day conference. I'd like to start by thanking the Dharma Civilizations Foundation. It's their generous support that has allowed us to hold this two-day conference. So we'd like to acknowledge them here. I'm really excited about this conference over the next couple of days. I myself study Japanese Buddhism. I think for those of us studying Asian religious traditions, we've been observing with great interest over the last few years the degree to which practices that had long been associated with Asian religious traditions have increasingly been brought into secular spaces and especially into medical and clinical research spaces. And so kind of seeing that trend has been very interesting. And what's I think especially exciting about this conference is that we're going to be able to see this from the other side, to see how medical practitioners, clinicians, and researchers are themselves integrating these practices into their work with patients and with research and so on. And that's something that those of us studying just the religious side haven't been able to see in detail. So I think it's very exciting for us to see how these practices are being integrated. I think that we're going to have a lot of really fascinating conversations over the next couple of days. I'm very much looking forward to the conference. I'd like now to turn things over to the conference convener, Dr. Rita Sharma. She has been a visiting professor here at USC for the last 2 years and has really done a lot to invigorate Hindu studies here at USC. We've been really happy to have her on board, and she's done so much work to organize this conference. So I'd like to thank her, acknowledge her here, and then turn things over to her.
Thank you very much, Lori, and thank you to the School of Religion for sponsoring the conference. Thanks particularly to the Dharma Civilization Foundation for all of their good work here at USC. One of the things that is most interesting is that this intersection of alternative and complementary complementary and alternative medicine and contemplative methods that have their roots in Asian traditions has been going on for about 20 years. It's been going on for very much longer than that, but the last 20 years has seen a kind of integration, very slow integration into research and into medical school curricula and so forth. But in the process, the conversation between philosophy, between the humanities, between religious studies, where this rightly belongs as well, and the scientific world, where the research is going on these new, ancient but new for us, methods of healing body, mind, and integration of the whole person. There's a disjunction between these two worlds, and we hope with this conference to bring these two worlds together. So, you have the Mayo Clinic, you have University of California at San Francisco's Osher, Center for Integrative Medicine, Duke University, University of Arizona, Cleveland Clinic, and many other centers of excellence in healthcare, offering yoga therapy, meditation, mindfulness as both wellness methods and treatment modalities. Duke University's Healthcare Center for Integrative Medicine, with many physicians and a very large number of healthcare supporting network, introduces its work in the following way. More and more people of varied ages, abilities, and health conditions are turning to yoga to find ease in body and mind. This trend is fueled, in part, by a growing body of research evidence suggesting that yoga, and of course related mind-body methods, may offer relief from a host of ailments ranging from hypertension and fibromyalgia to cancer, depression, insomnia, and so on. In fact, nearly 14 million Americans say that a doctor or therapist has recommended yoga and, of course, related mind-body modalities to them, according to a study by Harris Interactive Service Bureau, which was widely publicized. But what's interesting is that most, the National Institutes of Health's National Center for Complementary and Alternative Medicine, NCAM, lists its ongoing research projects, and it notes that most meditative techniques used today in healthcare started in Eastern religious, Asian religious or spiritual traditions, but that a 2007 national government survey found that 9.4% of respondents, representing more than 20 million people, had used these methods in the past 12 months for health matters. We hope that with this conference we begin a conversation between the disciplines that study these traditions and the world of scientific research which use these traditions. Thank you very much for being here. I want to now introduce Professor Duncan Williams. He is the past chair of the School of Religion, and he is currently the director of the Center for Japanese Religion and Culture.
Well, let me first thank the conference funders, the Dharma Civilization Foundation, as well as our conference organizer, my colleague, Dr. Rita Sharma, the Swami Vivekananda Visiting Faculty in Hindu Studies. I think the hallmark of Rita Sharma organized conferences are these very imaginative and very expansive conferences. Last year we had a wonderful conference that she organized that really expanded the scope of Hindu studies by bringing together scholars both within and without the tradition, scholars based here in the United States, but also from India, Canada, and Europe. And we hosted an international conference on the occasion of Swami Vivekananda's 150th birth anniversary, and focused on his vision of religious pluralism that still has, I think, resonance in our increasingly multi-religious and globalized 21st century. This year, she's organized, as you just heard, a conference that is expansive in a slightly different direction, focusing on the practices of yoga and meditation that come out of the wisdom traditions of Indic civilization, including the Hindu tradition. I think in the next 2 days we'll hear a really amazing assortment of speakers ranging from esteemed teachers and practitioners of yoga and meditation to scholars of Hindu studies, and perhaps most innovatively, scholars, practitioners, and healthcare professionals from the world of integrative health. And while it's not uncommon to hear of translational research or transdisciplinary research as critical modes of research production in the natural sciences, I think it's a lot rarer for those of us in the humanities to pursue these types of boundary crossings with our colleagues in, for example, the medical school. Of course, as a number of our speakers will note in the upcoming days, this type of integrative research where the boundaries between, say, philosophy, religion, and the health sciences are not barriers, but has research with consequences. This is not a new idea, and indeed can be seen as one of the very important modalities of scholarship from ancient India to contemporary India. So I personally very much look forward to hearing from my colleagues from Beyond the Humanities today and tomorrow. And to kick off this two-day conference, let me begin by asking to come up to the podium Professor Mark J. Regensburg, who serves as the director of the USC Institute for Integrative Health. He is on the faculty at the Keck School of Medicine in the Department of Pediatrics. He's also the director of pediatric endocrinology at the LA County and USC Medical Center. He has a long history with many of the aspects of the theme of our conference, including mind-body medicine, and he's been certified for many years by the Academy for Guided Imagery in that tradition beyond his medical training at the University of Chicago Pritzker School of Medicine and the Children's Memorial Hospital at Northwestern University. So ladies and gentlemen, please help me welcome Professor Mark Wiegenspark.
Thank you very much. It's really an honor and a privilege to be leading off a group of very esteemed speakers, researchers, clinicians, and practitioners of various modalities of mind-body medicine. Let me open my talk for you. So I'd like to thank the organizers and in particular Rita, who gave me kind of a broad area to cover, which includes kind of an introduction to integrative health and medicine, describing what the Institute for Integrative Health is here at USC, and then talking a little bit about my own work using guided imagery and mind-body modalities in the realm of pediatric endocrinology and specific diabetes, so both for interventions in kids who have diabetes or young people, and also for those who are at risk for diabetes. And I also want to give just a little bit of more of my own personal self, just so you know where I'm coming from. So, well, I think there's a slide to this effect, but I learned many, many years ago that really treating pediatric diabetes is about 10% education and Western medicine, and about 10% psychosocial, spiritual, basically, to get the kids with a chronic disease such as diabetes into diabetes balance. So that led me to exploring mind-body and complementary alternative medicine in the mid-90s and on. I got certified in interactive guided imagery through the Academy for Guided Imagery. And since this is sponsored by the Office of Religious Life, I'll give you my certification there. I've been a long-time student and more recent practitioner of the mystery wisdoms of the Hebrew tradition and ancient healing traditions that are not so well known. But perhaps there's some collaboration with the School of Religious Life that we can do in the future in that regard. So, okay, so. Well, Freud said the poets always precede us anywhere we want to go, so I always start a talk with a poem. And I want to, if you don't know Mary Oliver's work, I highly recommend it. Great nature poetry, poetry of the natural world. And I like this little short little quote because we're talking about mind, body, and mindfulness. So Mary Oliver says, instructions for living a life. Pay attention. Be astonished. Tell about it. Okay, so what is integrative medicine or integrative health? One definition that people often use is combining conventional medicine on the one hand and then complementary alternative medicine on the other. And this was kind of, I think, the standing definition through the 90s, maybe even early 2000s. And I think of this in these terms. If you look at the caduceus of the symbol of the Greek god Mercury. So this somehow has come to be recognized as a symbol for medicine, modern medicine, but in fact this is the staff of Mercury, the messenger god of the Greeks. And I think of these two modalities, conventional Western and CAM modalities, as the two snakes sort of slithering up opposite directions of the caduceus and somehow joining. But you notice when they reach at the top, they're still kind of maybe opposing each other. I don't know. So I like to think of this definition of integrative health or integrative medicine, which I think is coming more to the fore, which is really a medicine and a health dealing with the whole person as a human being. And this is really modeled by the great wisdom traditions. The whole system approaches of traditional Chinese medicine, Ayurvedic, indigenous healing systems, I would add to that, and others. But I do think there's a model for this in Western in the Western modern world, and that would be really the conjunctive use of allopathic medicine and what are called complementary or alternative medicines, where these are really used right from the get-go with a patient that's being seen and in combination, because it's clear that Western medicine has much to offer patients in certain conditions, and clearly the other healing modalities have much to offer, particularly in the realm of preventive medicine, preventive care, well-being, and chronic disease management, where I think Western medicine often falls short. So this is symbolized by this symbol, all right? So this is, depending on how you want to look at it, this is the staff with a single snake, and this is the staff of Asclepius, the ancient Greek physician. Or if you want to go back into the Hebrew tradition, this is the staff of Moses in the book of Numbers, where he put the copper serpent on the top of the staff, and when the people looked at it, the first incidents of guided imagery recorded in the Bible, when the people looked at the copper serpent, they were healed of the horrible inflammatory deaths that were going on at that moment in their journeying through the wilderness. Okay, so put on my hat as the director of Institute for Integrative Health at USC, and just give you a couple slides and let you know what that's about. So the Institute of Integrative Health actually got its birth only about 2 years ago. And our vision really is nothing short of transforming modern health approaches to health and healing. And I would say we're not alone in that mission, and I'll show you the next slide, which Rita actually alluded to. And taking into account all aspects of the human being, physical, emotional, etc. And I would say that I'm very proud that at the end of this we added the word environmental, because I'm often out hiking in nature, and certainly in the Hebrew and other traditions, being in nature is seen as really a way to heal, to be connected to earth, to be connected to trees, plants, animal beings, etc. And I know there's a speaker tomorrow on that topic, and I'm really excited about that. And I'm excited that we thought to include that. And our mission then is to promote the health and wellness of individuals and communities through the advancement of the three pillars of the university: research, education, and clinical care in the field of integrative health. And we are really, our vision is really, and our mission is really to be a transdisciplinary, trans-school collaborative institute, which is not an easy thing to do at a major research university where departments tend to be siloed off and schools are all doing their thing. And so that's why I think conferences like this are so important, to bring people who think differently together to really look at a problem and see how we can collaborate. And that's really what the IIH is all about. I'll go through this real quick. Basically, we consist of an admin core, and I just want to acknowledge some of the departments and schools that have supported us. The Keck School of Medicine through Dean Puliafito's office, the Ostro School of Dentistry, especially the departments of physical therapy and occupational therapy. The School of Social Work has been very involved with our efforts, and the Office of Religious Life, Dean Soni, right from the beginning, and Associate Dean Berklow, who is on our steering committee at the Institute for Integrative Health. So we started as a research institute funded by the Provost's Office of Research through the RCF, or Research Collaborative Fund, and our mission really is to develop collaborative research community at USC consisting of transdisciplinary faculty working towards the field of integrative health. And we've had great success. We've submitted a number of proposals. We have some external funding from many sources, including National Institute of Health, National Center for Complementary Alternative Medicine. Our educational program is really headed up by Dr. Armity Austin, who's in the Department of Family Medicine at Keck School, and she's developed great curricula for second year and fourth year medical students, and now we're looking into programs in integrative health that we might offer to undergrads and graduate students, and we're really just at the beginning of that. And our clinical care is kind of lagging behind, unfortunately, but we are getting things together to offer really clinical treatment for patients at USC in outpatient clinics as well as inpatient. So we're moving ahead, and I think for only 2 years in existence, I think we're doing pretty well. And then I just wanted to, one last slide, which I was telling Rita, I added this 5 minutes before my talk, which is the beauty and the curse of having PowerPoints, because you can be worrying about that and adding things at the last minute. So as Rita mentioned, there are a lot of schools now with integrative centers, and I just wanted, USC is now a member of the consortium of academic health centers for integrative medicine. And there are now 57 universities and health centers around the country who are working together towards this, really bringing about this paradigm shift in medicine within the United States and internationally. There are members in Canada. So this is the growth of the consortium, and now there are 57. At the time I made the slide, there were 51. I think USC was number 52. So we're a little behind the main wave, but we're catching up. And you have to be not only a practitioner of integrative health, but you have to be also either an educator or a research institute in integrative health. So these really are academic centers that are looking to promote the field, not only the practice of integrative health. Oh, there's USC, just popped in. Okay. All right, so now I'm going to shift hats again and talk to you a little bit about some of the approaches that we're taking here and my research in specific about mind-body approaches to diabetes management in children and in adolescence and into young adulthood. So first of all, what's the rationale for such an approach is that we know that stress affects diabetes in multiple ways. We know that diabetes is worsened if there's psychosocial disturbance, so that dysfunctional families or families that really aren't functioning well, those kids cannot get into good balance with their diabetes. And there's a lot of psychiatric disorders that are associated with diabetes, either often secondarily, but they also worsen the diabetes. So if someone's depressed and dealing with diabetes, it's very hard to get into any kind of glucose balance. And there's a much higher incidence of eating disorders, particularly among adolescents and young adults who have diabetes. This is what I mentioned earlier. This is no research data. This is my anecdotal experience, 25 years dealing with kids with diabetes, that 10% of the battle is education about diabetes, teaching how to give insulin, teaching how to test blood sugar, and 90% of the battle really is in the integrative realm of getting their psychosocial spirit, their mind, body, spirit aligned with actually having a chronic disease, and how do you integrate that into one's life in a way that's really healthful and health promoting, so that then the physical part of can be really in balance. The rest of the time I'll focus on stress, because as an endocrinologist I'm very interested in the neuroendocrinology of stress and then how it interrelates to metabolism, diabetes, metabolic syndrome, which I know we have talks on later this afternoon, which is cardiovascular disease risk, and obesity in children, which is of course a major topic in this day and age. So stress activates the hypothalamic pituitary adrenal axis, and the adrenal gland puts out stress hormones, cortisol, adrenaline, and this is good in the acute stage. If you're walking down a trail in the jungle and a tiger hops out in front of you, you want plenty of cortisol and you want plenty of adrenaline for that fight or flight reaction that you really need to survive, okay? Whether you're going to run or fight the tiger, you need these stress hormones to do it. However, in the circumstance or context of chronic life stressors, this system gets overburdened, and that can lead to adverse health effects, and that's very clear. And in terms of diabetes, we can see increased blood glucose, increased blood pressure, and in terms of obesity and diabetes risk, those people who tend to eat emotionally or for emotional reasons, stress often is a prompter, life stress, to overeating, and particularly when people overeat for emotional reasons, it's often, comfort foods, high in sugar, calories, and fat, and so this promotes increase in body fat and insulin resistance, and then promotes diabetes down the line, because that's kind of the setup for type 2 diabetes. So there are a lot of mind-body therapies for which there's literature. These are just some of the studies that are out there. I can't review them all in this short talk. I'm going to focus predominantly on guided imagery, since that's what I use in our research with kids, and I'll show you some of our data. And this cat just went through a stress reduction guided imagery, and he's very happy and calm. So what is guided imagery? It is considered a complementary alternative modality where the generation of mental images leads to a specific health outcome. We know, or it has been shown in other studies, and now in ours, I'll show you our data, that this can reduce stress hormone levels and actually can be used to transform health behaviors. All right, so Rita also asked us to do experiential components. So I can't describe to you what guided imagery, but if you'd like, if you'd like to, I wanted to give you just a quick sample of what some of the things we'll do that I'm going to show you in the next couple slides with the kids. So this is a very brief 2 or 3 minute guided imagery of stress reduction. So I invite you, if you wish, we'll have ourselves close our eyes. I'll facilitate you through this, and we're going to go on a journey to a place that represents just comfort and relaxation. So close your eyes if you wish, and if you're not comfortable with that, just let your focus dim as you kind of let your look forward, and focus first on your breath. Always begins with the breath, so let all other thoughts out of your mind as you recognize the in-breath, inhalation, exhalation, noticing how just focusing on the breath and letting all other thoughts go for a minute is already starting to calm you. Breathing in, breathing out. If thoughts come in and intrude, because that's what our minds do, or if you hear external noises coming in that distract you, just note them, no judgment. Let them go with the next out breath. Breathing in and out, noticing the relaxation coming over your body as you just focus on the breath. Breathing in and out, more relaxed than the breath before. And in the next breath or two, invite an image to form in your mind's eye that represents a place of just comfort and relaxation for you. It could be a place you've been before, or it may come completely out of your imagination for the first time to you now. Whatever. Just be open and inviting to the image that forms. Allow it to come into focus in its own time, quickly, or in its own time, maybe a little more slowly, but if the image is there, just stay with it, and if it's not, just stay inviting. And it may be that for this exercise for you, just focusing on the breath is the image, so stay with whatever comes. And if you have an image, I encourage you to look at it, see what you see. What objects are there, what colors, what shapes, what time of day is it, what is the light like in that image? Are there people, are there other beings there in this place of just comfort and relaxation for you? Looking around and seeing what else might be there. If you are in the image, where are you, and how do you observe yourself being in this place of just comfort and relaxation? Notice if there are any sounds associated with your image. Notice if there are any smells or aromas. Notice if there's any touch sensation, perhaps a breeze or a temperature that you might be aware of now that you weren't aware of a moment ago. As you continue your calm, easy breathing in this place of comfort and relaxation. And finally, just note how you feel emotionally in this place. Notice the level of comfort and relaxation you're experiencing. And over the next 2 or 3 breaths without my voice, just allow that feeling of comfort, relaxation to grow within you. Feeling that calm. And now, for the sake of time, because I have to finish this talk and we have to move on to other speakers, begin to bring yourself back from this beautiful place you've been. Notice the feeling in this room, the sound of the air conditioning, the feeling of the chair against your body, and in your own time, gradually, gently open your eyes. And I will continue with didactic lecturing. Everyone back? Okay. So I want to tell you about the Imagine Health study, which was a pilot study funded by the National Institute of Health, National Center for Complementary and Alternative Medicine. And we just published this data in BMC CAM journal in January. So this is looking at children who are obese, adolescents, actually high school students, obese with risk for type 2 diabetes. And the main hypothesis is that if you give interactive guided imagery for 12 weekly sessions on top of a lifestyle education that the control group also got, that we can reduce stress and we can promote behavior change, so that healthier lifestyle behaviors in terms of eating behaviors and physical activity. So that's the design of the study. And here are some of the main results, main outcomes. So These are individual sessions of the stress reduction imagery, similar to what I just gave you, but we did for about 15 or 20 minutes. And we measured their salivary cortisol pre and post each individual session. So just the first 3 sessions were really devoted to stress reduction. And the vertical axis is change in salivary cortisol from a baseline which was normalized to 0. So what you can see is that the guided imagery group, which is in the dark bars, at each of the 3 sessions had a dramatic reduction, an average of about 38% lower salivary cortisol at the end of each of the 3, including the first session. And mind you, these were kids who were really naive to any mind-body intervention. None of them had done yoga, guided imagery, meditation. You know, these are urban youth in the inner city here in East LA. So I was really amazed at the very first session doing what you guys just did. Actually, the first session was just the breath work. It wasn't even the imagery, and a dramatic drop in salivary cortisol compared to the control group, which was sampled at the same time of day, and they were doing another activity that was not involving any sort of mindfulness practice. So you can clearly, with what we just did, you know, we know that right now all of our cortisol levels are down a little bit than they were when we walked in the room. And this is the, after 12 weeks of the intervention, change in physical activity. So the group that got the guided imagery dropped their sedentary behavior, so less TV watching essentially, you know, less couch potato activity, almost an hour, which is really a large effect size, increased their moderate physical activity significantly after 12 weeks of the guided imagery. And we included in the guided imagery not just stress reduction, I didn't have time to go into it, but also imagery that was really devoted to motivating behavior change from within. So the kids would image themselves exercising or image themselves with an inner guide, helping them to develop really positive meanings for exercise within themselves. And so in this way, we think that this is what motivated them to increase their physical activity. We're not sure, so we're going to test that now, and we just got funded a year ago, and we're very excited because we're about to launch this on Monday. So this is the Imagine Health study in its next iteration. Health, by the way, stands for Healthy Eating, Active Living, Total Health. So total health encompasses stress management and other skills. So this is a 4-arm study. So we have 60 kids from local high schools in East LA in each arm. One arm is no intervention. Second arm is a lifestyle class alone, which is a very healthy eating approach. It's not a diet, calorie restricting approach, which is not recommended in general in pediatrics, but really eat healthily and be more active. And then the third group gets that same lifestyle class plus 12 weeks of stress reduction guided imagery, similar to what we just experienced. And the fourth group gets the full program that we did in the pilot study, stress reduction plus the behavioral change guided imagery. And the purpose there is to see, can you get the same changes in eating behaviors, physical activity, hypothalamic pituitary adrenal activity, or cortisol, stress, and well-being outcomes, whether you do the behavioral guided imagery or maybe just with stress management. Maybe that's enough for these kids. Maybe they can, you know, kind of make their own changes. So we're measuring them immediately after the 12-week program, after a 6-month booster program of monthly classes, and then 6 months later. So stay tuned. This, like I say, this study, we're just launching it on Monday with the pilot program, and then the full study will launch in January. We're collaborating with LA Unified School District for this study. It's going to be delivered in an after-school program, and with a nonprofit organization that's delivering the lifestyle class, SOS Mentor. So, all right, a few quick slides about type 1 diabetes, and then I'll conclude. So with type 1 diabetes, insulin-dependent diabetes. So these are young people who require insulin. This is an autoimmune disease. But stress leads to high blood sugars, and this is clearly known through either direct or indirect mechanisms. In our studies of young adults age 18 to 25, we found the more life stressors they have, the higher their hemoglobin A1C, which is an overall measure of their blood sugar, and that their perceived stress, using perceived stress scale, correlated directly with their blood sugar by hemoglobin A1C. In other words, more stress, higher blood sugar. Okay? So with this population, we did a pilot intervention using, and I'm using this slide to transition myself, using a group facilitative practice called Counsel. I'll show you that in the next slide. But really, I just wanted to introduce what I feel is an exciting new area that I'm getting into, which is the power of the narrative, the power of a person's individual story to promote healing. And there are a number of researchers in occupational therapy, preventive medicine, social work that are really looking at this. And Louis Mel Madrona is a Native American family practice physician and psychiatrist, double boarded. Actually, I think he's triple boarded and something else, I can't remember. But if you're interested in this topic, I highly encourage you to read Louis's work. It's really quite remarkable. So here's what we did. We used this facilitated group process of counsel. What is counsel? It's based on indigenous practices across the world. In this continent, predominantly Native American practice, sitting in a circle, passing a talking piece which empowers the speaker to speak and everyone else just to listen. So it really promotes deep communication, was used to develop consensus and make big decisions in the villages and things like that. And it really promotes trust and depth of communication. So sitting in a circle, everyone's equal in this circle. There's no hierarchy. Even though I'm in the circle, you see me there, I'm not the doctor, right, in this circle, telling these young people what to do. I'm really participating with the wholeness of myself in the circle. Speaking from the heart, listening from the heart. And we used a lot of integrative modalities in the circle across 12 sessions, every 3 weeks about stress reduction imagery, narrative storytelling. So both the young people had the chance to tell their personal stories with diabetes or life in general. Okay, we used all. And also we used mythic, universal stories. So mythic stories where the mythic archetypes, the young people could really tie in their life journey with the story characters and thereby start to learn a little bit about themselves through that and relate their life in general, their diabetes as metaphor, the struggles they were having with their lives in general. And in this way, try to integrate diabetes into their lives. So we had some very positive responses from the kids in focus groups, really about, really loving the program. And you'll see what happened. I trusted the group. Everybody felt equal. Increased relatedness among group members. This is very important, I think, and really critical for healing, that we really start to work in groups and in communities. I feel like they're there with me. This is long after the program. This young woman was remembering her experiences in the group and using that to empower her through some of her struggles with diabetes many months later, feeling safe within the group. These are some objective data. Again, perceived stress scale. This is after the 12 sessions. And in the counsel group, we saw a significant drop in perceived stress with no drop relative, highly significant between group difference there. And effect size, for those of you who are in the research world, an effect size above 1 is really quite a large effect and very clinically significant. So I'm working now on a grant to go forward with this and do this in a bigger way, on a bigger scale. And this was also very exciting, that even though we didn't see a significant drop in A1C in the counsel group, although there was a bigger drop in A1C than any other, but it was a small study, didn't reach significance, but perceived stress correlated, the drop in perceived stress correlated with their drop in lower A1C after the 12 sessions. So I'm excited to see what we might do with this in the future. And I'm going to close here with just one more little thing that we're getting into, which is, as I mentioned early on, the role of nature and environment in healing. And back in 1999, I took a group of kids with type 1 diabetes on a canoe trip, and on the canoe trip we dealt with, again, the metaphors of what we were experiencing in nature with what they experience in diabetes. So these two young people shooting the rapid here, what you don't see in this picture is at the bottom of this rapid, down here was a big cliff of stone, and you had to traverse around it. The river turned to the left, and these two didn't turn. So they hit the wall, and they jumped out of their canoe. And so we pulled over to the sandbar at that point, and we said, when do you hit the wall with your diabetes management? When does that happen? And we had an incredible discussion, and they had an incredible learning from their experience with the river. And last summer, working with a fourth-year medical student, Ali Arastu, if any of you know him, we took a group of kids, this is a high school group, up to Golden Trout Wilderness up in the Sierras, where they experienced yoga, which is what you see here every morning amongst the fir trees and the pine trees. And they were taught how to cook healthily and go on hikes and be physically active. And we got some great information from them about just changes within themselves from that experience. Again, lowered stress values, and we're working on the manuscript for that. I didn't have time to show you that data. Okay, so I'm going to close with a poet. I was going to close with another practice, but I'm out of time. So I think most people in this room probably know Rumi. Again, in this earth, in this soil, in this pure field, let's not plant any seed other than seeds of compassion and love. And along those lines, if you don't know it, tomorrow is the International Day of Peace, and there's a worldwide meditation at noon in this country starting tomorrow, so maybe this conference could bring in a little meditation at that point. I was going to guide you in a compassion meditation, but I'm out of town. Tomorrow. So give peace a chance, as John Lennon said. It's a reasonable thing to do. Thank you very much. Do I introduce the next person, or do you want to? Okay. Are there any questions? We hadn't talked about this before, so yes.
For your health study, those 240 kids, how they were doing?
We're recruiting them through the schools, and we're collaborating with the LA Unified School District. So we get school teachers who want to be part of the program and are actually going to be helping to teach the program, the Healthy Lifestyle Program, and school counselors. They can be physical activity, or they can be PE teachers or counselors, or I think for next week we have a chemistry teacher involved. And they just really want to help to promote healthy lifestyles among their students. So they're helping to sort of pre-recruit, and then they identify the kids who are interested, and then we go in and speak to the families and sign them up for the program. The students are age 14 to 17, typically sophomores or juniors in high school. Louis Mel Madrona, MEHL hyphen Madrona, Madrona. Yeah, sir. I'll repeat the question. So the first question is, if we did this in older populations, what kind of resistance might we meet? Right? Yeah, and secondly, how might this play out in other countries, and whether we have collaborators? And I would say no, but if anyone's interested, I'm a very collaborative person, and that would be wonderful to do something with folks elsewhere. In terms of older populations, I'm not sure. I think the resistance or the problems, the obstructions to developing healthy lifestyles that we're seeing in our population are both external and internal. So there's external, environmental problems or obstructions to developing healthy lifestyle. For instance, in our neighborhoods, safety, gang violence, crime, things like that keeps kids from going out to the parks and being active in some neighborhoods. And then the internal resistance, which is just, like anybody, changing health behaviors is one of the most difficult things to do, even when you know intellectually to do it. And that's why I think these mind-body modalities, whether it's guided imagery or some other form of mindfulness or anything, kind of gets past the cognitive, and starts to stir things up on the other emotional realm that you can start to work with some of those resistances a little bit. I'm sorry? Or even biochemical or neurochemical. Sure. Okay. Yes, sir.
One comment or two small questions. Very impressive because you're introducing the mind-body concept at the early age, and I go to very well with you, right? So you're trying to introduce in adults also. My second question is, the family members are involved in changing the self-assessment, and how the kids are going to follow this and not this strategy, mother and father or mentor and brothers are not doing it. That must be very important.
Yeah.
The second thing, what was the plan in the pilot study?
Okay. Good questions. So the first question is, what about the families? Because we're working with the kids, or how are we working with the families? And secondly, what was the end? So the pilot study was about 15 in each group. It was a small study. Was funded as a an exploratory grant through NCAM. The family is very important, obviously, in pediatrics, and we can do anything we want with the adolescents, and if the families don't change. So we are working with the parents, and we're delivering a parental component to them so that they really understand what we're trying to do with the kids. And of interest, part of the lifestyle education program is that the high school students, I didn't mention this, but the high school students learn in the 12 weeks of the lifestyle education, they learn the program in the first 6 weeks. In the second 6 weeks, they actually teach the program to elementary school students, so even younger, although we're not studying the elementary school students, but by mentoring, we think that that even empowers the kids to really learn the program better and really own it. And also, they teach their parents the program. So there's a component of students teaching the parents what they've learned in the program so that the families are really on board. And I think we have to stop there. So thank you again very much.
Thank you, Dr. Wiggensberg, for sharing your very inspiring and exciting research. I know that there are probably a lot of questions still that people have. I hope they can catch you during lunch or one of the breaks. So it's my pleasure to introduce our next speaker, Dr. Fred Davis. He's a professor and director of the Center for Brain, Consciousness, and Cognition, and is also the dean of the graduate school at Maharishi University of Management. Dr. Travis holds a PhD in psychology, and he also completed postdoctoral work at the University of California, Davis in basic sleep research. He has done a lot of groundbreaking research that's been published in numerous journals. He has won awards from the editorial board of the Journal of Meditation, Research, and he's also the recipient of an NSF graduate fellowship. It's my pleasure to introduce him now. Thank you.
Mark, that was impressive. Thank you very much. I wanted to dive more deeply into the meditation part of the conference, meditation, yoga, and integrative medicine, specifically looking at the full range of meditations. I'll be talking about categories of meditation. And by analogy, are all exercises the same? No. You can do strength training. Strength training has its own philosophy, it has very real effects, it has its own purpose. You may do aerobic exercise. That also has a different philosophy, it has a different purpose. Or you may do posture exercise. So as exercises are different, they have different theories, they have different endpoints, and so I'd like to suggest meditations do as well. So I'd like to look at different meditations in terms of 3 different categories. First 2, focus attention, open monitoring, Anton Lutz has delineated. Focus attention is what it sounds like. You keep one experience in your mind at a time. When the mind moves, you go back to it. Open monitoring, you allow all experiences to pass through the mind with dispassionate observation, just noting, not trying to control. This 3rd category, automatic self-transcending, is a category which I and Jonathan Shear proposed, and that's for meditations that transcend, that aren't involved in thinking and controlling the mind, but rather transcends the steps of the meditation practice. The first 2 categories of meditation keep you involved in thinking, attention control. The 3rd, you start with thinking, you end up just with being. And each of these type of processes have different brain patterns. When you focus the mind, you see gamma EEG. That's what you see in your brain right now. Here we are Saturday morning, we're at a conference, I just had a very stirring talk by Mark, and we forgot what time it was. We forgot who's on either side of us. We forgot what we're going to do for lunch because we really are getting into the details of the experience. When you do that, this is what the brain does. They're short-range connections. It helps you take a specific piece of experience out of the ongoing stream. Non-reactive monitoring, when you're just watching internal experience, what you see is theta. It's theta 2, 6 to 8 hertz. Theta 2 is thought to be generated by the cingulate, and what it is, it's attention directing, it's attention monitoring. Transcending, that is just having the attention turn within and awake. We see a different brain pattern. This is alpha, and specifically it's alpha 1. Goes up and down 8 to 10 times per second. This is an example of the alpha wave. In all of these, time is the x-axis, a second per column. We see as the mind is transcending to just wakefulness, we see a similar pattern over the whole brain. And what we did in the paper is we asked what is reported during different meditation procedures, and we found that these meditations report gamma EEG, compassion, Zen, Qigong, Vipassana. Theta, these meditations reported this is Zazen. Oh, that's not right. Sorry. This should be saying mindfulness meditation, Kriya Yoga. That was my error. Those meditations that report alpha include transcendental meditation, also a case study of a master, a Qigong master. I like to reflect because you might notice that Qigong is in focus attention in gamma because it is a controlled process of moving energy through the body. It's also here, and I think it's here because of automaticity. Psychology knows that doing any controlled process over and over allows that process to become automatic. So what can happen is, and indeed when this master first started his practice, there was gamma EEG. After doing it day after day for 45 years, when he started his practice, we saw this mark of alpha activity, of just inner wakefulness without directing of attention. Transcendental meditation, the automaticity is built into the practice. In terms of how these different meditations interact, and this is really the important point we need to consider, is meditations in focused attention, open monitoring. I'd like to suggest they construct mental tools to cope with life. Mindfulness, you become acceptance to thoughts and feelings that arise, so that when you're in activity, you can be acceptance to what's happened to you in the past, acceptance of what's happening to you currently. It's a cognitive tool. It's something that you can do with the mind to help deal with the world. Automatic self-transcending doesn't develop a cognitive tool, but it leads to a change in mental state. And this change in mental state is then what helps behavior afterwards. By analogy, creating cognitive tool is like learning how to use a knife in a different way. Changing mental state is like taking the knife and sharpening it. And then when you take the sharp knife back, when you take deep inner silence back into your thinking and acting is transformed. That's conceptual. Let's look a little bit in terms of the brain. So here's the brain. This is the brain's looking to the right. This is the thalamus. And specific nuclei in the thalamus, they're called core nuclei. They're localized specific points. It's where outside information comes in. Then the thalamus signals the cortex feeds back to the thalamus, and it's this ringing which encodes the experience. The experience comes through very quickly, but it's this ringing that lets you know what I'm saying. We're actually about 150 milliseconds behind what's actually happening, but we're able to put it all together through this ringing, so it seems like we have a continuous experience here. So this is one level of input. This other level of input comes from inside. Content comes from outside. From inside comes wakefulness. It's up the brainstem, it's the reticular activating system, and again the thalamus talks to the cortex goes back, and this feedback, rather than encoding content, specificity, encodes wakefulness. This is what modulates throughout the day. And as our wakefulness modulates, how we're able to perceive the world is going to change. So in this model, the process of transcending is just a matter of systematically reducing content. And then what's left is wakefulness. This experience could be called nothingness, and often in the Buddhist literature that's what it's called, because there's no content. There's no thinking mind, there's no feeling heart, there's no experiencing ego, there's no stream of content, but what is there is wakefulness, self-awareness. What we could say is, the content could be wakefulness. I'll say this again. What we could say is this experience of pure wakefulness has no content, or we could say that the content of this experience is wakefulness itself. It's not alert to, it's not process seeing, it's just wakefulness. It's as if you're taking the mind back to just being aware, alert, and then when you go back into activity, it can stream forth. I'd like to suggest that this, what we're looking at here, is a brain pattern of yoga, the state of yoga. Patanjali, in the second verse, he describes yoga in this way. Yogas chitta vritti narodaha. Yoga is union. Chitta is mind. Chitta is mind. Vritti are fluctuations. They're not waves. There's more internal interactions. Narodaha, completely absent. It's not as though the mind's quiet, but rather all of fluctuations are completely gone, completely absent. This is a state of yoga. Kat Upanishad describes it in this way. I'll let you read it. You know the self when you're, and this is big S self, when your senses are still, your mind is at peace, your heart is pure. Let's look at this experience relative to waking, sleeping, and dreaming. We have a 2x2 grid, content, yes or no, sense of self, yes or no. What would be in this cell here where there's no content and no self? We have waking, sleeping, dreaming. Sleeping, yes, thank you. That's what we were in last night. And we know when we're asleep, we're not aware of what's going on. We're not aware of self-awareness. We're out like a log. Now, what would have content and sense of self? Waking. That's where you are now. PowerPoint, my words are the content. But there's also a sense of self. You're experiencing me from where you're sitting. Are you in the back and you have all these people in front of you? You're experiencing yourself from what else is going on in your mind. This is waking state where these two are intimately connected. This one here, content and no self, I like to argue would be dreaming, where there's very engaging dream images, which we're completely lost in. That leaves this cell here. Now, if William James was in the audience, he would say, Dr. Travis, that doesn't exist. It's just an artifact of your 2x2 grid that you created here. He actually said, I do not find an abiding state of consciousness. That is a state of consciousness non-changing. He says, all I find is changing streams of consciousness. And typically this is what most modern psychologists would say today. And indeed you may be thinking, how can I be aware of myself if I'm not aware of this inner-outer dichotomy, if I'm not aware of my thoughts, if I'm not aware that I'm an individual experiencing? Now notice, this is really describing waking state, because in waking state, you can't have the self without content. They're intimately connected. But through transcending, through meditation practice, you can experience the state of just yoga. Or I like to call it pure consciousness, pure meaning unmixed with thought activity. Now, what is the brain pattern of this? So here, it takes 50 milliseconds to go from the thalamus to the cortex, 50 milliseconds to go back. That's 100 milliseconds. So in a second, this is going to happen 10 times. And this is what we see here. These are brain waves during the state of yoga, during transcendental meditation practice. X-axis is time. Each column is a second. We can actually count this. It goes up 1, 2, 3, 4, 5, 6, 7, 8, 9. This is an alpha wave. We see it here as well. Notice it's going over the whole brain because it's just wakefulness itself. There's no specific content to break it up. Also notice that the rising and falling of this wave, they're very similar. And you can quantify the phase, so the angle and how high it goes, and you can look at the relationship between the phase of different points in the brain. And that's called coherence. And what coherence is giving you is if parts of the brain are working together. So this is coherence during the experience of yoga, during transcendental meditation practice. Top is the top view, front view of the brain. These are different frequency bands. Dots are where you record brain waves. Lines between dots are where coherence is very high. Notice in this experience of yoga, of just wakefulness during TM practice, the major coherence is in this alpha 1 frequency band. It's primarily in the front. It's quite symmetrical left and right, front to back. Very little gamma or beta because it's not a technique of control. Just want to take a note on alphas because if there's any neuroscientists here, you'll probably equate alpha with idling. And indeed, that's often what is seen. This interesting paper looked at EEG relative to brain functioning, and they found idling, the higher alpha, alpha 2, 10 to 12, was correlated with the task, if the task was on or not. And the parts of the brain that were active were the temporal cortex, which are details of experience, and also hippocampus, which has to do with memory. But they found there was non-task related alpha. And that is the alpha rhythm would go on independent of what the task was. And this was lower alpha. It's 8 to 10 hertz. And this is that value of wakefulness, because there needs to be some overall level of wakefulness within which experience is being integrated. And another blood flow study during this experience, brain is looking at me. During the experience of yoga, there's increased blood flow to the front of the brain, decrease to the brainstem. So the brainstem, the part of the brain that activates you, gets you going, breath rate, heart rate, blood flow is lower there. I think that supports the experience of restfulness for mind and body. But it's not a passive experience. We see that it's highly alert, the front part of the brain, the prefrontal cortex, the anxiety, the attention center, decision-making, planning. There's heightened activity here, heightened blood flow here, decrease here. Okay. So in terms of, we've looked at in detail brain waves during one type of meditation of one category, and that's the automatic self-transcending. But to compare what's happening during transcending with another well-known finding is lateral asymmetry is known to change in mindfulness practice. The left front part of your brain is what governs and directs the rest of your brain. So specifically emotional tone. They find if the left frontal area is more active, you have better control over emotional impulses, you're happier. The right side of the brain is more active, you're actually more depressed. So this is a great deal of research which has supported that. So I thought, well, it would be interesting. Let's take some people. Let's teach them transcendental meditation. We'll look longitudinally, and we'll look at both lateral asymmetry and coherence. And this is to get at this issue of meditations are different, they have different purposes. Well, does lateral asymmetry change during TM practice? And what we found is no. So this is a baseline. This is 2 months, 6 months, 12 months. There's some decrease, but it's not significant. This is during the meditation practice. This is during eyes open task afterwards. This is what happened with coherence. And what we're seeing here is state changes very quickly. From eyes closed to 2 months TM practice, there's a very significant change in coherence, and then it remained at that high level throughout. But what's interesting is the state change quickly becomes a trait change. Notice during eyes open, there's more and more of frontal alpha coherence during the task. And this is the therapeutic effect of adding that experience. Whatever you do to the brain, whatever experience you give the brain, be it guided imagery, be it mindfulness, be it stress, be it whatever, the brain changes, it adapts to make that more part of how it functions. So what we're seeing here is if you add the experience, of yoga, of the transcendent, that experience of just wakefulness, of lively screen of awareness becomes there more and more during the day. Let's look at two clinical application of this. One was looking at attention deficit hyperactive disorder. Pre-test, we measured their brain waves, and there's an EEG measure of attention deficit hyperactive disorder. It's theta-beta ratio. So it's one frequency, theta, which has to do with internal processing, over beta, which is more the processing itself. So we find that pre-test, both groups had high levels of this measure of ADHD severity. And then the TM group practiced transcendental meditation. It's done 20 minutes. On this group, they were 10 to 14-year-olds, so they meditated 10 minutes a day, twice a day. And then we recorded their EEG again at 3 months, and we see there's a significant reduction in this EEG measure, severity of brain, severity of ADHD. Then the delayed start group learned TM, so both groups are meditating at this point. Both groups are transcending. They both move towards normality after 6 months of transcending. This group is now within the upper end of normality. We sent this off for publication, and the reviewer said, "Give me a break," because they would meditate in a group. They would say, "These guys don't have ADHD. You know, how are you going to get 10 to 14-year-olds with ADHD sitting in a group closing their eyes?" They say, and it was a very astute comment. And indeed, 2 or 3 of the students could not. So we would take them out and we would meditate with them individually. But then after 2 or 3 or 4 months practice, they were able to sit and meditate. And the reason it's the case is, remember I mentioned automaticity is built into the process of transcending during TM. What you learn to do with transcendental meditation is use the natural tendency of the mind to take the attention within. So it's not individual control, individual evaluation. You learn how to use the natural tendency of the mind. And what that is to grow, to expand. That's what's driving the ADHD kid for everything that they do. I really enjoyed interacting with these students because children with ADHD are not passive, they're not inert, they're not boring. They're highly curious, they're fun-loving, they're exploring. It's just they can't control those impulses. It's that natural tendency of life which is driving them out, and they're not able to deal with it, and so they're a problem in class. But that same natural tendency they can harness to turn the attention within. Okay, one last clinical is just post-traumatic stress disorder. These are African refugees, Congolese refugees from the Congolese Civil War. They were in Uganda. They had no home. They were in facilities that were given to them by the government. They couldn't have a job, so it was hard for them to get food. They came, again, we pre-tested, and this is the post-traumatic stress checklist. Pre-tested them, randomly assigned them to either learn TM immediately or at the end of the study. 30 days TM practice, their severity of PTSD had gone to non-symptomatic and remained at that low level 174 days. And this is, again, for therapy, is the effect of changing the mindset, changing who you are, who you are aware of what you can do and be, and that when you come back into the world, you see the world in a different way. I'd like to just end with this picture. This integrative medicine is a synergy. It's a synergy between Western and Eastern models of health, Eastern models of what is valuable for growth. I think what we also should embrace is a synergy of meditations. Meditations are different. They have different purposes. I think their general goal is the same, to explore inner subjectivity, but how they do it and the benefits are different. And so to help maximize our effectiveness of integrative medicine, I think it's good to expand our awareness to explore different meditation techniques. Thank you very much. Any questions? Yes, sir.
The end of recognition. You've got to have concept. And the student would say, no, there is no self. No content, there's no self. And so much philosophy, they are correct. I don't care.
Yes, the end part of what you said. You cannot get out of the waking state conundrum by using the waking state intellect. The only way is you have to transcend. You have to transcend thought and experience what is there when my thought settles down. What is there when concept settles down, when individuality settles down, and you have an experience. The Vedic texts describe it in great detail. The Upanishad tells the whole story of the fourth. So it's an experiential reality. Once you have the experience, and then you can bring it back into your philosophy, but without the experience, it cannot be part of your philosophy. And so I think this is the great excitement of this age, that the Eastern meditation techniques are coming to free us from the shackles of our thinking and our concepts and our philosophizing, to experience what is there when the mind settles down. And then what this does, it helps actually to allow us to continue to develop. Because as we see, this is a fourth state of consciousness. This is uniquely different from sleeping, dreaming, and waking. And that's what the Upanishads call this. They call it the fourth. And then you can integrate the state of yoga with waking, dreaming, and sleeping, and that's the beginning of enlightenment. So what this does, it opens up to the Western community a new vision of what it means to be human. But it's rests very much on experience. Without experience of that state, it's only conjecture and it's only speculation. Deep insight. And I think Kant was getting towards that. And in his three major works, I think he was realizing there was something there. I think he had some spontaneous experience. Yeah. Yeah. Yes, and what especially the Vedic text gives us is concepts, models that satisfy the human intellect, so we can expand our understanding. It's like talking about a wave and ocean, and all the Western philosophy is talking about is the waves and how they interact. But if you can settle down and become the ocean, suddenly you have a whole different model. Okay, there is a field of awareness here. It rises up in specificity in this way. If there is that underlying awareness, it suggests a lot of things. Individual waves should be able to interact at a distance because they have that common basis and so on. Thank you for those points, sir. Other questions, comments? Yes, sir.
When you come to get dark corner apart, you are choosing the door. What becomes the concept? Yeah. You can't say there's no concept. You want to achieve the truth, except because
Yeah, it's a great paradox. Because if you try to get there, you never get there. And so you stop trying and then you get there. And I think on one level, I think the goal is to bring this into activity. I think that's the whole point that the Vedic text is telling us, is that state of yoga, pure consciousness exists. That in itself cannot be the goal of life because your eyes are closed. You're sitting there. You're not really helping the world. The goal is to contact it and then drag it into activity. This is great. Other points? Other comments? Yes, sir. Yes, I'll leave it with Lori or whoever I should leave it with. And also in my presentation is my email if people have other questions. Good. Other questions? Very good. Thank you very much for your attention.
All right, welcome back. I hope you are all well caffeinated now. And we're going to be starting very shortly, so I'd really appreciate it if you'd kindly take your seats and ask your questions to our speakers maybe at lunch. And thank you. We have a wonderful panel coming up. Okay, anyone who is still outside, please come on in. Our mindfulness panel is beginning, and you wouldn't want to miss it. The name of our panel is the Panel on Mindfulness, Integrative Medicine Education, and Mindfulness Research. I want to first of all thank Dr. Anshu Vashishta, who is the chair and organizer of this panel, and he's a member of our external organizing team. Now, Dr. Vashishta will go first. The name of his presentation is Mindfulness 101. Students in the audience will certainly appreciate that, I'm sure. Dr. Vashishta is a board-certified physician on the clinical faculty of University of California, Irvine, who has served in leadership roles in the development of new treatments for serious diseases such as cancer and cardiovascular diseases. He graduated as the best all-round graduate of the very prestigious All India Institute of Medical Sciences in New Delhi, India, and obtained his PhD in immunology from Rockefeller University, New York. So he's MD, PhD. He then completed a residency in internal medicine at the Albert Einstein College of Medicine, New York. He has worked in pioneering and transformative companies like Genentech and Amgen, while developing a personal meditation, mindfulness, and spiritual practice informed by many traditions. He has also been an organizer and active participant at professional meetings at venues like Drug Information Association, the Food and Drug Law Institute, the Drug Safety Research Unit of the United Kingdom, the FDA, the Virginia Tech Center for Applied Health Sciences, and much more. He also has a very keen interest in integrative medicine and the studies of science and spirituality, and has studied many contemplative traditions in great depth, and is familiar with a lot of the methodologies that we're discussing today. Ladies and gentlemen, please welcome Dr. Anshu Vashishta.
Thank you so much, Rita ji. This is really a pleasure, and I think I and my co-panelists really are grateful for the opportunity to be with you all this morning. So one thing I would like to do is just for our panelists to understand how many of us are high school or college undergrad students. Excellent. How many of us are medical students or residents or grad students? Not too many. They're all busy. I think some of them are playing a volleyball game, though I understand today. And what about physicians? and people who consider themselves mainly religious or traditions of religion scholars or interested in those. Okay, so that gives us a sense of the mix. So we are really happy to participate in this dialogue, Ritaji. I think this is really more of what we need. We often seem to work in silos, so we really appreciate the opportunity to do this together. So I'll begin just by showing you a couple of slides about my take on mindfulness, and then Dr. Rael Khan, who's really an expert on the neurophysiological changes in meditation and mindfulness, will take us into more depth, including an experiential session. I'll introduce him a little more formally later. And Dr. Priyal Chamba, who is also a practitioner of many mind-body systems and has been a leader in integrative medicine education at UC Irvine, will also talk to us about education and integrative medicine. So with that, let's jump into a few slides. So I think just my one slide take on what mindfulness, how we could describe mindfulness. It has all these dimensions to me, and I just wanted to put up the quote by John Kabat-Zinn, which is in the black, which you can read. And also Laura Chabot has talked about it. And I think of it in terms of different dimensions, of having a non-judgmental attitude, being in the present, paying attention, being non-reactive and open-hearted. So those are some of the ways I tend to think about it. And Rael will, I'm sure, jump into more and give us an experience of what we mean by it. In terms of roots, I think it's, well, my formal source of Wikipedia informs me about the translations originating from the Pali term sati and its Sanskrit counterpart smriti. And this is one area where, Ritaji, I think we need some more, a lot of the literature seems to start in the 60s and 70s, and we really need to connect and draw the line back to see what was the human experience with these states and what's that thread like. It didn't all start so recently. And I think that's one area where I would like to see more work done. There are definitions in the Vipassana resources that Goenkaji has been leading. And if I think we can, from this panel, we can just consider it like we're projecting a travel brochure for you. And if we can inspire you to go on a journey, your own journey into mindfulness, that would be what I hope to accomplish in this time. Please pardon the busy slide. I just wanted to take it, again, my take on mindfulness practice and mindfulness meditation. And without going through every word, there is really a formal sitting down part of mindfulness practice to me, which is the mindful meditation, if you will. And then there is the practice of it during your day and other exercises that can help you be mindful. And we can come back to that sort of in more Q&A later on if we need to. I just wanted to give you again a quick teaser, of course, from PubMed. If you go from this year's publication, well over 400 already, you can see how the publications in the scientific literature in medicine have gone from barely a couple decades ago to touching 500 now. So it's really a fertile field of research being explored in many different ways of mindfulness-based stress reduction, for which UC Irvine, for example, has a program where we do, the integrative medicine department does trainings for community members as well as the members of the profession. We have a compassion program in mindfulness that there is training at UC Irvine, and many other dimensions in which there are workshops and trainings. And again, we can go into them in some questions. So with that, I'll introduce Dr. Khan. He is going to talk to us, and please feel free if you have adapted your title, the neurophysiology of meditative states and traits of consciousness. As you see, he grew up in the Pacific Northwest, became engaged in meditative practices as a practitioner while an undergrad at Evergreen State College program in Olympia. And then he started the MD PhD medical scientist training program in a little south of us in San Diego in 1999. There he also had a holistic and integrative medicine student group at the School of Medicine, taught a course on meditation and medicine. So I'm eager to learn, to hear more from him. He has then done a PhD in neurosciences, looking at the neurophysiological correlates of meditative states, and he has published a very influential review article based on this in the Psychological Bulletin in 2006. So now he is, after doing some NIH-funded postdoctoral research, a fellowship in geriatric psychiatry with Dr. Dilip Cheste at UCSD. He's also completed his residency in psychiatry and is now on the faculty here. So it's really, really a pleasure to introduce you. Let me get your slides up, and please welcome Dr. Ayal Khan.
Okay, thank you so much for that kind invitation and introduction. So, I want to be clear about what the time frame I should keep to is. What do you think? Okay.
If you can cut it down to 30 without cutting without driving us with much
Right. Okay. So, I'll be speaking to you a bit about some of my own work, which is using EEG measures, both during spontaneous meditative and restful states. Hi, Fred. As well as kind of overviewing the literature, looking at specifically more the mindfulness forms of meditation and how they affect the brain through a number of neuroimaging kind of studies that have come out over the last 10 to 15 years. I want to just kind of overview that literature to you. But at the end, I'll kind of bring that together with more of a focus on how this is clinically relevant and how it's being brought into clinical settings, both in psychology as well as medicine over these last 10 years, especially some of the studies that have even been done looking at neuroimaging in combination with clinical intervention of mindfulness meditation, and some preliminary ideas that we now have based on these first few studies, which is really what I'm kind of getting engaged with here at USC, is setting up those kinds of studies as well. And then I will be going into a little bit of looking at that big picture of integrative medicine and mindfulness, some of the changes at the biochemical, molecular, biologic level that we're also finding from these kinds of interventions. But to start with, I have a couple of slides talking again about what is mindfulness. And now that Dr. Fascista has already gone over this, I'm not going to belabor the point too much. But except to underline this kind of theme that he mentioned, that we're talking about a form of human awareness that has been practiced by human beings for thousands of years, and just in the last, let's say, 50, 100 years at the most, it's been translated into English, and now there's a scholarship growing up around this in the last 10 to 20 years. In Western philosophy, science of mind, and psychology. But some of the things that I can say that point to it are, kind of taken from some prominent teachers, like John Kabat-Zinn, who, and for those of you who don't know his work, he was really one of the most influential folks to bring mindfulness into the Western kind of conversation, starting with his work at the University of Massachusetts in the early 80s, developing this program called Mindfulness-Based Stress Reduction, which is an 8-week course wherein mindfulness techniques, mindfulness meditation practices are taught over the course of a 2-month period, once a week classes. And these courses were given primarily for patients with chronic medical illnesses. And throughout the 80s and 90s, he was leading these courses, and eventually, as people got more and more benefit from them, he became more well-known. And now, stemming from his work, the mindfulness-based stress reduction kind of model has been incorporated into medical systems throughout the world, even back in the East, but certainly in the West. And in addition, the kind of distinctions he made around mindfulness and the teaching of mindfulness have been incorporated into psychology. He's actually a biochemist by training and got involved primarily working with medical patients in a medical center. But, it's a kind of more natural home for mindfulness as a distinction and as a practice within the realm of psychology. And it was really partly through this kind of back door that it has come to prominent discussion within psychological circles over the last 15 years. He defined it as paying attention on purpose in the present moment, non-judgmentally to the unfolding of experience moment by moment. And, it's a very concise way of getting at, again, this experiential thing. And I will take us through a little practice here in a few moments so that it's not so conceptual. But a couple of other very prominent teachers in mindfulness practices, Thich Nhat Hanh is a Vietnamese Buddhist monk. He defined it as mindfulness is simply to be aware when you're breathing in, to be aware when you're breathing out. It's the capacity to be aware of what is here. Anything can be the object of mindfulness, your breath, the sky. It is to be in touch with our felt experience in each moment. And Jack Kornfield, a prominent Westerner who did quite a bit of training in the East in the 60s, early 70s, and then brought these practices to the West through Insight Meditation Society, defined it as mindfulness is to distinguish awareness from mental activity, to learn to be aware of our own mental states without being caught in them. And all of these, definitions point to something in the realm of awareness and present moment kind of focus, but with a focus not just on identifying or being in our thought process, but in the kind of a wider sphere or field of awareness, that thought is just one of many things in our capacity for awareness moment to moment. And as we disengage from the identification, the tendency to be really caught up in our thoughts, we get a sense of this greater spaciousness that it's possible to live inside of. So with that, I want to just go into a little practice time. I'm going to sit down. I'm just going to encourage you all, if you're not especially interested in an experiential aspect, feel free to keep your eyes open or close your eyes and daydream, whatever you like to do. But I would like to encourage you to join me in just coming into an awareness of your body and your breath right now. And when you're ready, closing the eyes, just allowing the eyes to come to a close in a relaxed way. And bringing the body into a position of kind of neutrality. If you notice, you may be leaning to one side or the other. The two arms, bringing them resting on the lap, or folded one in the other. Whatever is comfortable for you. There's not a position that is necessary, but it can be helpful for engaging in this kind of practice to have a relaxed and symmetrical posture. And if possible, within the confines of this chair, allowing for the back to become a bit more erect. Comfortable, but in a more erect and awake posture. And turning the attention to just being here right now. Seeing if it's possible to attend in this moment to the sensation of the breath entering and leaving the body. You might notice the sensations in the abdomen, on the in-breath, the slight expansion of the abdomen with the in-breath. Contraction with the out-breath.
or the sensations of breath may be more clearly experienced right around the nostrils for you. Noticing sensations on the in-breath of the air passing by, the entrance to the nostrils, the upper lip. And on the out-breath, perhaps noticing the sensation of the air may be a bit warmer, now having been warmed by the lungs. And noticing the tendency of the mind to engage in spontaneous identification and recollection to the past or the future, preoccupations. And whenever you notice the mind has wandered from this moment, being in the body with the breath, just noticing where it's gone to and gently bringing it back. This is the nature of the mind. Always flitting to and fro. By just acknowledging and bringing back awareness to this present, letting the mind settle on this moment. Nowhere to go, nothing to do. Just being present, the breath, this moment. Now expanding the awareness somewhat to notice the sensations in the body as a whole. Not just the sensations of the breath. The abdomen expands and contracts, the chest and lungs expand and contract with each breath. But the sensation of the body as a whole. Sensations from the feet, through the legs, pelvis and abdomen, up through the torso, hands, arms and shoulders, neck, head and face. Bringing the attention to the sensations in the body in this moment. As much as possible, sensation itself. Noticing the sense of the body being breathed. And now taking these next few moments just to kind of survey the sensations of the body, the quality of the mind and emotions in this moment. Just noticing what's present here for you now. The thoughts are fast or slow, intense or gentle. Sensations, pleasant, unpleasant, warm or cool. Just noticing what's present in awareness at this time. And in a few moments, after taking perhaps a few deep, relaxing breaths, coming back to eyes open. So that's a very short taste of the beginning of these kinds of practice. So we thought it would be important to at least have a little bit of experiential aspect to this to keep it from being too much in the head. You might have had this kind of thought yourself just now.
when engaging in meditative practice, whether mindfulness or through other approaches, one of the things that most people will notice is that it's not always, peaceful and wonderful. You are faced with whatever the human condition is for you, the nature of the mind. As these kinds of practices have been brought into psychology, I just want to kind of highlight one thing before getting into some of the brain studies, which is that the field of psychology has really acknowledged now that the distinction of mindfulness, which has the kind of definitions I've been talking about, but also can be quantified using measures like we use to quantify anxiety or tendency towards extroversion, introversion, or depression. This can be trained through different approaches. The mindfulness-based stress reduction approach developed at John Kabat-Zinn that I mentioned, but subsequently different very well-known and well-validated approaches for improving people's psychological functioning have been developed. Some of them include dialectical behavior therapy, acceptance and commitment therapy, mindfulness-based cognitive therapy, which is really a direct kind of morphing of mindfulness-based stress reduction for depression specifically. Mindfulness-based relapse prevention, which is focused on using these kinds of mindfulness practices for people with addictive disorders. And then a whole profusion in the last 5 years, as this has actually caught on to the point of being an easy way to make money even, mindfulness-based, whatever you want, fill in the blank. And initially the idea behind mindfulness-based stress reduction, the reason why it's called mindfulness-based stress reduction as opposed to just mindfulness meditation or, stress relaxation therapy, is that the idea is that the mindfulness skills that we learn are actually specifically interacting with something about their stress response. And the stress response is this very well-known cascade of biochemical pathways and homeostatic dysregulation in the body. It's mediated ultimately through the brain, the central nervous system, getting signals that are interpreted as being in some way possibly dangerous to personal survival. And this has very good adaptive properties within our biological evolution as a species, and other animals have the same system for this reason, that as we see danger in the world, the brain activates, the pituitary releases ACTH, the adrenal glands release cortisol, epinephrine, as well as cortisol. These chemicals have broad-ranging effects in the regulation of different organ systems in the body to essentially prepare the fight or flight response as opposed to the rest, relaxation, and digest pathway that is kind of more the default when we're not overly stressed out. And one thing that's really worth highlighting, and it's kind of at the center of the way that mindfulness gets translated into a clinical intervention as opposed to being a branch of personal development and the kind of progression towards enlightenment as it was really conceived and brought about, is that this initial step of the brain sensing danger is something that gets hijacked in our modern society, so that we are sensing danger where danger doesn't really exist. We're responding to the experience of, for example, going out on the street in public for people who have a panic disorder, as if that's a tiger approaching us in a jungle. And, that's kind of an extreme case, but all of us have some degree of a dysregulation of our tendency to get stressed out and perceive danger in situations where there's no true danger. And so that's all mediated by this organ up here, the brain. And because of this hijacking of the brain circuitry, we're highly social animals, so a lot of this has to do with social interactions, sensing danger related to something about our sense of being socially accepted or not accepted. But regardless of that, the kind of hijacking of our stress oversympathetic nervous system because of these perceived dangers that have nothing to do with actual biological lack of integrity for the body, lead to real difficulties with our long-term health and wellness. And well, there's just a slide to show, the B lymphocyte, T lymphocyte, macrophages, the molecules of the stress response system in ways that are, being more and more worked out over the last few years through the field of psychoneuroimmunology, affect the immune system in very significant ways, decreasing our capacity to fight off the ever-present viruses and bacteria in the environment, as well as our capacity to have the regenerative functions within the other organ systems, the heart, the lungs, the kidneys, the liver, be working at full capacity so as to lead towards more and more chronic illness. So there's a classic understanding that stress has numerous profound negative impacts on health and illness initiating progression, but the growing understanding as we're coming to really understand the stress response and, well, what is stress all about, is that there's a very significant part of this stress, what we traditionally call stress, which is actually related to cognition, related to how we're interpreting our environment, and that our interpreting of the environment is what leads really to the release of the stress hormones. So the same situation can happen to two people, somebody who is able to interpret the situation as, oh, I'm going out into the public to enjoy my time, instead of I'm going out into the public and I'm scared that something bad is going to happen, of course won't have the downstream kind of sympathetic nervous system overactivation, and again, that's just this extreme case I want to bring up, but it applies to everyday life for all of us in ways that individually you can probably relate to. What stresses you out, and the fact that there's something about your individual way of perceiving and thinking about that thing that is actually critical to you getting stressed by it, as opposed to it being something objective out there that is causing the stress. So why do I go into that? Because mindfulness as an intervention in the clinical sense is really critically working on that tendency of the mind to automatically react, not just with stress, but in other ways as well, and kind of giving a capacity for greater awareness and less automaticity to our responding to life situations. So speaking a bit about mindfulness, meditation, and the brain, I'm going to talk a few slides about some EEG studies that I did for my own PhD, looking at measures of attentional engagement and as well as automated reactivity to auditory stimuli, using a real basic kind of cognitive task, and then go into some of the fMRI studies, which also indicate increased attentional engagement on body awareness with concomitant decreased automaticity of cognitive reappraisal and negative affect, and changes in the underlying baseline connectivity patterns of the brain, as well as structural changes. And this is kind of like an overview slide of some of the neuroscience I want to go over with you, and then the clinical implications. So neuroplasticity refers to the fact that the brain is constantly rewiring itself throughout our life. Not only that, it's also true that new neurons are being produced every day in our brain, and this is kind of one of the real fundamental shifts that's taking place in neuroscience over the last 15 years is this understanding that it's not just that we have so many neurons that we're born with, and then from that period on we're going downhill, which is really what it was thought for quite some time, but that we do have both the regeneration of neurons occurring deep in the brain and the hippocampus throughout life, and not only that, the circuitry of the brain is really constantly being reinforced based on what we're attending to and what kind of activities we engage with. Reinforced, and then those circuits that are not being reinforced are lost, and that territory is taken over by new functions based on what we are attending to, what we are doing. An example of that, some of the early studies showing functional and structural neuroplasticity related to what we attend to were shown using an intervention with a kind of training program of juggling for people who didn't know how to juggle, showing that in the course of a month, if you practice a couple hours a day and learn how to juggle, you see gray matter changes in terms of the thickness of the visual and association sensor motor areas that actually are associated with learning this new skill, as well as white matter changes. You know, the functional kind of coupling, the white matter tracks that connect these cortical areas becomes thicker. And similarly, by engaging in practices like meditation, which don't have an external kind of prop, but simply an internal engagement, we are seeing now more and more evidence that the structures and functions of the brain are trained and adjusted through such practices. These couple of slides here are overviewing some of the findings from work I did with long-term Vipassana practitioners. When they were brought into the lab, Vipassana is the term for to see clearly. It's really the form of Buddhist meditation practice from which this term mindfulness was adopted. And bringing these long-term practitioners into the lab, having them meditate for half an hour, and then try to not meditate for half an hour in a counterbalanced way. Some did meditation first, some did the thinking task first. And seeing what's different in the brain, comparing those two states of trying to stay still with eyes closed, engaged in the meditative process, versus keeping the mind busy with thought. And a couple of the things that came out of this work include the decrease in the frontal delta power. As you can see, the kind of comparison for these two states, meditation and mind wandering. The red in this comparison graph shows statistical significance for these frontal electrodes, showing a decrease in this lowest frequency delta power. And delta has to do with inhibitory functions in the brain. It's the kind of power that becomes predominant in deep sleep when our brain is really kind of offline, although there are some interesting interactions between that and long-term meditation as well. But just the simple overview here is that there's an increase in frontal activity indexed by this decrease of the delta power, and an increase in the parieto-occipital gamma power, this highest frequency activity that seems to be related to ongoing conscious awareness and the clarity of awareness. So this overall is indicative of kind of an opposite to sleep effects, a kind of a more awakened brain state. And a second aspect of this work I did was presenting a series of tones that sounded something like this. I don't know if we have audio here. We probably don't, so I'll just say, you know, this is a series of tones, one tone presented every second, sounding something like this. Boop, 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 beep, boop, 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 boop. So it's very boring, and it goes on for about 5 minutes. But that's the series of sounds that they heard while they were either meditating or in this mind-wandering task, with the idea that we know a lot about how the brain responds to these sounds. The boops that the brain gets used to are treated as, well, that's just kind of background noise, I don't need to pay much attention. But the beeps and the sounds really tend to engage the both sensory and frontal cortical processing. This is unexpected, and the sound is even kind of like annoying. So how did the brain respond to these kind of sounds in meditation versus mind wandering? This early measure of the degree to which the brain encoded the strength in the first 100 milliseconds of these sounds showed that in the mind wandering task compared to meditation, there was actually less strong encoding. You can see here, especially for this oddball beep sound, that the N100 response was greater, the more blue or negative. So indicating something about, you know, greater encoding of stimuli during a meditative task. Although they're not trying to pay attention in either state, somehow in the meditation state, the stimuli are making it in to a greater extent. But the the later evaluative processing of these stimuli, which is especially engaged to the beeps and the ent sounds, you can see in the mind wandering especially, is just not as positively responded to in the meditation state. So despite the fact that these stimuli are being encoded to a greater extent, the evaluative processing kind of automatic reactivity to, mediated through the frontal cortex, is decreased. This is a very nice dissociation because it gets at this essential distinction with mindfulness practice of, it's not that we're tuning the world out, we're actually becoming more attuned to what's happening both in the inner and the outer aspect, but becoming less automatically reactive to, the degree to which we respond in a reflexive way is decreased. And this is just another measure of this induced theta power that showed a decrease, that showed an increase in the meditation state to the boop sounds, these kind of habituated sounds in the background that normally are just kind of treated as, well, there's nothing really happening there. Even that sound becomes, to some extent, more encoded in those, as measured by this measure of theta synchrony. So something about what I say here is something about beginner's mind, that we're seeing each ongoing stimulus as fresh and not just background, but something is happening out there, and it's not just to be ignored or treated as if it's not happening. So during the resting state, there's these measures of enhanced frontal brain activity and greater clarity and awareness, whereas with the stimulation, enhanced representation with a decreased reactivity, a dissociation not typically found with these kind of experiments, where normally the greater degree to which you encode the strength of such stimuli, visual or auditory stimuli shown during these kind of brain experiments, predicts how much the frontal cortex is going to respond. Greater encoding, greater responding. So we see a dissociation there in meditation, which is interesting. However, this doesn't get to the essence of what's the transformation that's really happening inside people's experience while they're meditating. And there's some recent fMRI findings that do kind of point in this direction. Here's a illustrative example of maybe what everyone else here experienced when I asked you all to try to sit and meditate with me. Okay, we're going to sit and meditate, and then, we've either got a frog or a rock star on our mind. We're not just going into blissful absorption into waves of energy bliss in the body. Typically, the mind is doing its thing. But there is some change that happens if you do these types of practices with time, as many of you, I think, do. It seems from the hands that were raised before. You notice some changes taking place, and now we're starting to understand some of the kind of functional brain architecture of what is responsible for that. So this is a study with long-term practitioners looking at the different stages of that basic meditative experience of being engaged with the object of meditation. In this case, it was a basic breath-focused meditation, but it could be a mantra or a visualization or an energy in the body. And then noticing from time to time, oh, my mind has wandered, I'm thinking about what I have to do later, or, how pissed I am at my boss, whatever it is. And coming back in that, noticing the mind wandering, coming back to the object of meditation. And these fluctuating cycles tend to go in this focused absorption, mind wandering, something happened, then you happen to become aware of the mind wandering, and that speed, a big part of what happens if you look at studies looking at what happens with training over time is you become more sensitive to when your mind wanders and more quickly able to bring the mind back. And so that's why it's really being conceived within the cognitive neuroscience field as a kind of an attention training is part of what's really going on here. Becoming more and more attentive to what is actually in our mental contents moment to moment and able to notice and bring back the shifting of attention back. And different areas of the brain are reliably activated at each of these four stages. Interestingly, the focused absorption was found in this particular paradigm, looking at the cycle to engage some right frontal area, but the mind wandering part, before you catch yourself, is very much engaged with the
medial prefrontal cortex, posterior cingulate cortex areas. And these are areas that are now referred to as kind of key parts of the default mode network. And so that's what I'm going to go into in some more detail to kind of flesh out what we now know about how the brain works in normal and pathological states, as well as how meditation seems to be affecting that. So this is a normal, healthy part of the way the brain works, that in addition to being able to focus on what's happening out there in the world, we also have this tendency to kind of mind wander, talk to ourselves. And when we're not focusing on the external world or on some external task of some kind, the areas of the brain that become more active have been referred to as the default mode network, this kind of default when nothing else is taking our attention. It includes this posterior cingulate, medial prefrontal areas, inferior parietal areas, and some temporal areas. And this was discovered because experiments with fMRI that were always looking at, well, what area is responsible for attending to this or that, were building up in number. And about 5 years ago or so, the field started to take notice of the fact, well, we're kind of ignoring something. What are the areas that are becoming less active when we attend to things? What areas, in other words, during this control task where they're not asked to do anything, maybe there's something interesting happening in the brain there. And this is the finding, is that these areas are actually becoming reliably activated, and subsequent work has really elucidated that in association with these areas becoming more active, there's also the subjective sense of the mind wandering and kind of telling a story to ourselves about ourselves and our days. And this particular quality of mind, the kind of story that we tell ourselves that kind of makes up our sense of who we are and what we identify with, is really at the heart of what meditative practices seem to be changing. So looking at a number of studies, which I won't be able to go into in detail because of time limitation, but I do want to show a couple, both using stimuli that activate this default mode because of the tendency to activate self-reflective, a self-narrative process, as well as looking at the brain just during meditation state. We're seeing more and more that this default mode network is altered through long-term practice and even through a short-term intervention. So this is a mindfulness-based stress reduction, 8-week class intervention using before and after the presentation of positive and negative personality adjectives in the scanner, with the instruction for participants to engage in a mindful, noticing the word but not engaging in much thought about the word, versus really noticing the word and whether it's true for them. Is this somehow an adjective that describes myself or not? And noticing how the brain processes in these two different modes of kind of mindful awareness, acceptance, versus judging and evaluating, and how that's modulated through a mindfulness practice. This is first the study of just showing that when these words are shown compared to a control, just showing a cross that doesn't engage the self-reflective processing, this default mode network that is shown to be activated when we're not attending things also becomes activated by this self-reflective processing of, seeing these words appear. And in the trained practitioners compared to the novices, what was found is that there was this ability to adopt the experiential focus to a much greater extent, as expressed in the change in brain activity compared pre and post this mindfulness training. So here they're showing the engagement of the default mode network, this medial prefrontal areas and posterior cingulate, was actually decreased, specifically in the trained MBSR practitioners, but not in the novices. And a similar finding was obtained, looking again posterior cingulate as the primary kind of essential node of the default mode network, that experienced meditators compared to novices had a significantly reduced automated induction of this posterior cingulate default mode network activation to sounds, emotionally kind of evocative sounds that were presented while people were in the scanner. And I want to kind of respect the time and start bringing this to a close, despite the fact that I didn't get through most of my slides. But I think we're going to have a moment at the end to entertain some questions as a panel. But just from what I've said so far, I think it would be helpful to just open up the floor for one or two questions to kind of, address what may have been brought up through all these detailed brain scans and terminology. Yeah. I'm pointing to you.
Yeah, so I understand everything you're saying. Where I get confused is we're less judgmental, we're less reactive, and et cetera, but we all have to make judgments once we make choices. I'd be integrated. That's where I'm seeing
Yeah. I think that's a very important question, especially, as a psychiatrist, somebody who's really interested in how these kinds of practices really take root and affect people's quality of life. That's an important distinction there. And I don't think that we have studied enough to have a real good kind of research base to draw from. There is a very clear distinction that people with a history of depression or chronic anxiety really have a sense of relief from learning this kind of skill with their mind. But looking at the specific of, well, does that also engage their ability to deal with the kinds of issues of life that are around self-efficacy, that kind of, well, you do have to make a lot of decisions throughout your day, and are you feeling more capable of making those decisions and being fully engaged or not, I don't think has been surveyed in the clinical literature as effectively as it should be. I can say from my own personal experience and the feedback of people who've gone through some of the mindfulness kind of trainings I've done, that it's definitely more the norm that people will report a sense of being freed up from their kind of obsessive thoughts about themselves and interpretations that are self-limiting, so that they are feeling more able to deal with the stresses and demands of life, including being able to make better decisions for themselves. But I do think that it's an area that deserves more kind of attention and study.
Thank you, Ryan.
Yeah.
So thanks very much again for. So I think we'll sort of jump into the panel by inviting Priyal. Let me share his bio, and then we can have Priyal talk to us about the journey of a healer through integrative medicine, and then with that we will jump into the panel, just because of the time. But I think my goal is again to really invite you to see where this journey could take you, and that's what I would like.
Integrative medicine education should really be emphasized at the undergraduate level. So my path took me straight to medical school in this MD PhD program, and when I first started the MD PhD program at UCI, there wasn't a club for integrative medicine, but I knew that I was interested in it. And I would have really enjoyed exploration of integrative medicine at the undergraduate level. By the way, integrative medicine is the intelligent combination of Eastern and Western medicine in an evidence-based way, for example, incorporating acupuncture, mindfulness into Western medical practices in a way that's culturally sensitive and in a way that is also evidence-based. So I started the Club for Integrative Medicine at UCI, and I was really, really energetic about it, and I found professors that would give talks, and I hosted these professors to my medical school class. I would send a broad email to everybody, and here's a prestigious chair of the NCCAM, Dr. Shin Lin, would come to give a talk about complementary alternative medicine. And by the way, the NCCAM is the NIH branch of complementary alternative medicine, the branch, the department that supports research funding in complementary alternative medicine. Dr. Shin Lin is a big deal. And out of 400 medical students, maybe 3 showed up to this talk. So I was really embarrassed by this. I felt like, did I do something wrong? Maybe this is not such an interesting topic. So what happened is that an undergraduate student named Doug Chung contacted one of my mentors, Roger Walsh, and he told him, I'm really interested in complementary alternative medicine, meditation, how do I get involved? And he pointed at me and he said, why don't you go talk to Priyel? He's been working on this stuff for a while. Now, not every undergraduate student has the energy that Doug Chung had and has. He's a very incredible person. But so what Doug Chung was able to do was open my eyes to the potential that the undergraduate world has for enabling movements for integrative medicine at a university campus. So we went from having small talks of 3 medical students to having whole classes actually for topics like compassion in healthcare and other talks on integrative medicine, because undergraduates, I could speculate why undergraduates have more energy for this kind of a thing. I think there's actually a couple of noteworthy points there. One of the points is that medical students are kind of at the penultimate step for where they're going to be in their careers. And there's a lot of really demanding work hours for medical students. And so even if there's interest, and a lot of times there is interest, there's very little time to explore that interest in the turbulent environment that is medical school. Now, I want to say that an undergrad is equally challenging as medical school, and still more undergraduates are there when this happened, and it opened my eyes to this phenomena. So another possible reason why, and I think this is the important one, is that undergraduates have not yet reached their penultimate stage for their career. A lot of them do not yet know where they're going to go, and even if they think they know where they're going to go with their careers, there's a lot of direction. There's a lot of opportunity for changing that direction at that stage. And so these are people, young people that have a lot of potential. That's the word that I want to emphasize, the potential. So an undergraduate student that gets interested in integrative medicine, complementary alternative modalities, can take that, what they learn in the undergraduate level, to nursing school, to PA school, to acupuncture training, to their medical doctorate training, and you get what I'm saying. So in the context of all that, and also in the context of the growing interest in the West in all these modalities, like everybody is learning today, how Dr. Khan has been talking about mindfulness exploding in terms of research, in terms of practitioners using it, in terms of the evidence base. There's going to be more demand and interest in these in these alternative fields, and I think it's important to introduce it to undergraduates early so that they can explore that. So I'll briefly say one thing to administrators: enable them. Brief story about that. A couple of the undergraduates for the Students for Integrative Medicine applied and received this very honorable award called the Dalai Lama Scholarship for creating this class called Compassion in Healthcare. And the Dalai Lama actually flew these undergraduate students to India to meet him. This is how prestigious of an award this was. So when they created this class, they wanted to teach compassion in healthcare to the students, so they looked for a department to host it, and every department said, me, please me, because the Dalai Lama Scholarship, it's a big deal. So that year, 200 students filled that class, and it filled up like this. Next year, that was a great idea. We had 200 students fill the class like this. Everybody got a lot out of it, a lot of positive feedback. Let's have this class again. And then the department said, not me, because the Dalai Lama Scholarship was over. So with perseverance and working with administrators and finding a mentor in the School of Nursing called Dr. Olshansky, who's an incredible professor and mentor and a wonderful person. So with the guidance of senior administrators, faculty, and good mentorship, one of the undergraduates, Gabriel, especially spearheading this, was able to bring the compassionate healthcare class out of the School of Biology, who no longer thought it was biology enough, and into the School of Nursing, where I think it is actually quite appropriate, and it continues to fill up. So that's just a little story to underscore the importance for the students to learn how to work with administrators, to learn how to navigate who need to help them to navigate this complicated world. In a university academic setting, it's not simple to cut through red tape to start a class, and that's just one example of how you can make change at a university. So work with the administrators, find good mentors, and then mentors and administrators enable them. Thank you very much.
Thank you. Rita, do we have time for questions? Do you want to invite some questions? Or, yeah? Okay. Or if you want to lead us and tell us when to stop.
Coming up here essentially to be a school marm and take care of the time.
There you go.
Because you don't need me. First of all, I want to thank all of you for absolutely brilliant panel. The reason that, we couldn't meditate as well under your guidance, Rael, is because you were so interesting before that. Our brains were way too stimulated. So next time, start with that. Okay, so let's take some questions. We have about 10 minutes. Yes, let's start at this end and move this way.
For Dr. Rael, you mentioned the 4 areas of the brain that were more active during default mode, like mindlessness, sort of, when we're unaware of the medial prefrontal cortex, et cetera, et cetera. And I was wondering, if it was those 4 areas of the brain that were found to be like overactive. that sort of default state of being, is there something that those 4 areas of the brain share in common? Like, obviously they serve a healthy purpose also.
Yeah.
A very functional purpose
Right.
also. Is there something that they specifically, those 4 specifically share in common?
No, I mean, that kind of functional connectivity underlying the what we call the task negative network, or the task positive network of the brain that's kind of always shifting back and forth across seconds, time scale, with this task negative, kind of more internally focused processing, thinking, conjecturing. That's the main thing that they share. Otherwise, if you look at them individually, they have very different functions. The medial prefrontal area is involved with a lot of functions, but includes relationships with emotion, with self-processing in particular, like self-judgments versus other judgments, with the posterior cingulate being kind of the central node of this these 4 areas, and not having too many distinct functions outside of that being the central node between the areas, and then the temporal cortex having functions with both emotion and memory and semantic processing, and the infraparietal lobe being this area that is very much engaged with attention, and in particular like the integration of different sensory areas into what's going to grab attention moment to moment. And spatial orientation. So, each area is really very distinct, but then when they come together in this kind of fluctuating way that they are coming together for all of us, it somehow mediates this kind of default state that we fall into. Yeah.
Those of us who were lost in the neurophysiology, there is, I think, a book called How God Changes Your Brain. Would you say that might explain some of this a little bit?
I actually have not read that particular book, so I can't.
So I would recommend it. I think the part of the purpose is to show you different avenues you can take, and if something is too technical, don't feel that's the only way. I think there are many ways to explore this study.
We had some questions in the middle here. Okay, If that's someone's phone, I'd really appreciate it if you'd be kind enough to shut that off. And if it's not, maybe it's divine grace because of all our meditation. Okay, I think you had a question.
You know, in the cellular or interneuronal stuff that changes. Like, why don't I need Xanax when I'm, calm?
So that's a very complicated area to talk about. Well, what I can say, just to kind of point at distinguishing the question you're pointing towards, is that the way that the brain works is that neurons are in communication with each other. These billions of neurons across trillions of synapses, and how we can measure that is imperfect. At best, just to say it's imperfect. We cannot conceptualize this many activities happening all at the same time in a way that is meaningful. It's just too much. So we have these other measures that we can, well, at least we can say we can measure the electrical activity that the brain sends off, which we know is very kind of more closely related to the ways that neurons communicate to each other than this other measure of deoxyhemoglobin that the fMRI picks up. And when we look at these electrical signals, which is what the EEG does, we see this very confusing kind of squiggly line coming from every electrode on the brain. And that squiggly line, when you decompose it, is made up of lower frequencies, intermediate frequencies, and higher frequencies, all the way from 1 hertz up to 100 hertz. And so what you're pointing to is that these different frequencies of activation that are a reflection of how the neurons are communicating are it's not understood the way in which those many different frequencies happening throughout the brain are correlated to our brain internal experience. I should say this other realm that we can't measure with a device, which we can only point to out of reflecting and trying to give report on our subjective experience. So it's a very imprecise, non-one-to-one mapping that we currently have. And we do have some, experiences in with research showing things like, well, if you have an increase of some of the lower frequencies, the alpha and theta frequencies, that seems to be correlated with being in a less anxious state. We can say that. But, that's a very indistinct, imprecise kind of hand-wavy thing that has some real truth to it, but it's not really precise about which brain areas in particular are generating this alpha and theta signal that is really correlated with that sense of ease. We don't know that yet. And that's partly because the EEG, we do not have nearly as much specificity in space as we do with the fMRI. We have a lot of specificity in time. You can see moment to moment what's happening in the EEG. But to resolve what's happening in the EEG to a specific spatial location is non-trivial. There's an indefinite number of configurations of brain activity, electrical activity, that could be contributing to any given measurement at the scalp of electrical potential. So, there are different candidates, but no, it's not. There's no accepted way to find out, that question of when we're seeing more alpha at this scalp area. What are the different brain areas that are making that happen? So I just want to say that we don't know is the big answer, and that's part of the reason we don't know.
We can only take one more question from this side. Melina, hold on. Would you stand up?
Okay, this is for Priel. Thank you so much. And thank you all for time, or if you had something to add as well. But being undergraduates, I guess I just want to ask, what are some of the benefits that you see from doing integrative medicine on a day-to-day basis? Because we do deal with a lot regarding school and administrators.
Do you mean from practicing some of those modalities, integrating them into your own life?
Yes.
Oh, yeah. So meditation, as we've been talking about during this conference, is a perfect example of a modality that could really facilitate decreased anxiety, more awareness, kind of excellent way to regenerate, recuperate in a way that will make you a more effective student and actually a more effective navigator of life. We're constantly bombarded by choices and decisions that we make, and to be able to make those choices and decisions mindfully will kind of elevate your ability to succeed. So I'm a big advocate of mindfulness and meditation. But that's preaching to the choir today, isn't it? Don't forget nutrition and exercise. Oh, and here's one that you should keep with you for the rest of your life is whatever your passion is, even if that's not your career direction, always continue to follow your passion. So if you are in a demanding time in school, don't forget to do whatever it is that you love to do, whether it's knitting or whether it's whatever. For me, it's rock climbing. Even though things are crazy in medical school right now, still make time to go to the climbing gym or outdoors every once in a while. And you have something like that you're passionate about. And there's times when school is extremely busy or life is extremely challenging. Make time for that. Because recreation, if you break down the word to its components, really what it is recreation of yourself. And if you don't take time to recreate, then you're going to get burnt out. So do that.
Please join me in thanking this fantastic panel. Thank you, Priel, Dr. Khan, Dr. Vashishta. Thank you very much.
So to conclude this morning's session, I'd like to invite Professor Philip Clayton to come up and deliver the keynote address for this conference. He's not only the Ingram Professor of Theology at the Claremont School of Theology, but also the Professor of Philosophy at the Claremont Graduate University. He's, in many ways, such an appropriate keynote speaker for this conference. He's been, for so many years, involved at the intersection of the study of religion and science. And as a symbol of that, he's the winner of the Templeton Prize for Outstanding Book in Science and Religion, and one of the first winners of the Templeton Grant for Research and Writing on the constructive interaction of the sciences and religion. He's the author of very many books, both a single author and edited, including The Problem of God in Modern Thought, God and Contemporary Science, and Explanations from Physics to Theology, an essay in Rationality and Religion. Today he'll be delivering a speech entitled The Roots of the Medical Uses of Yoga, Meditation, and Mind-Body Therapies. So please help me to welcome Professor Philip Clayton.
Before beginning any spiritual text or quest, it is customary to clear the mind of all distracting thoughts, to calm the breath, and to purify the heart. Or, as is said in the Shanti mantra for the Upanishads of the Rig Veda, my speech has its rest on my mind along with the other senses. My mind has its rest on my speech along with the other senses. O radiant Brahman, manifest thyself in my mind. You've been talked through meditation by Raul Khan. I'll just ask you now to practice that for 1 minute as he taught you. And take a deep cleansing breath to conclude and come back. Ladies and gentlemen, what are the spiritual roots of yoga, meditation, and mind-body work? Consider the analogy with American Buddhism. In Tibet, you encounter the full range of Buddhist metaphysics, the gods, the stages, the entire metaphysical framework. Now, California Buddhism is famous for reducing all of that down to some practices and to the simplest distillation of that metaphysic possible. That's what California Buddhists were good at. Maybe yoga is similar. Medical professionals are interested in the therapeutic aspects, but underlying the therapeutic effectiveness, there are just a few core beliefs. They're not difficult to follow. Knowing these beliefs is not essential for utilizing the therapies effectively, but it is fruitful for practitioners to understand the sources of the yoga that they employ. It's my experience that the actual practice of yoga meditation is deepened by also practicing the three branches of yoga, jnana, karma, bhakti. That is the quest for knowledge, the quest for good works, and the quest for devotion. So I hope that you will experiment for yourself. Yoga is an experimental science, as it were, and see whether the practice that you currently have is deepened by including this focus on the pursuit of knowledge, the pursuit of good works, of purity, and the pursuit of devotion. And tell others what conclusions you come to. For today, though, in the short period I have, what light is shed on yoga from the sacred Hindu texts and the tradition of reflection on the Dharma, which in Hinduism is known as Vedanta? Yoga is a discovery, in fact, a whole set of discoveries by human beings in ancient times about the human body, the mind-body connection, the centering of the self, wellness, and healthy living. And of course, these principles, once discovered, can be used by any practitioners, even those who are ignorant of the context of origin. Still, at least we should acknowledge that those who are interested in the practical effects of yoga, in its use in therapy and in medicine, should also be interested in the deeper roots of this practice and the thinking that was a part of those who first made the invention. So in just 10 minutes, I want to walk you through some of the sacred texts and give you a sense for this world out of which contemporary yoga arose. Let's begin with the Rig Veda, of course. There was not non-existence nor existence. There was no realm of air, no sky beyond it. What covered it, and where? Who knows then whence it first came into being? He, the first origin of this creation, whether he formed it all or did not form it, whose eye controls this world in highest heaven, he verily knows it. Or perhaps he knows not. I love that. It always brings a smile to me to read this text from the Rig Veda, even the one who's the origin of all. Maybe he doesn't know. It transforms our approach to think beyond what is given, but the purpose is not exhaustive knowledge like a medieval scholastic theologian in the West, or as in the mode of science, but obviously the goal is a transformation of self, both prakriti and purusha, both body and soul. All right, you probably know that the first origins of yoga come in the classic Upanishads about 2,500 years ago. And then there's a second set of texts, Upanishads written 500 to 700, years ago. We have 108 of these. Most have been lost. And the 20 are called the Yoga Upanishads. Yoga comes from the Sanskrit root yuj, Y-U-J, which means to bind or yoke together. In its original context, it meant the union with the divine, the union of this self, this Atman that every living being has, and that divine ground of all things, Brahman. And three Sanskrit words expressed what this union was. Tat Tvam Asi. Thou art that. What you really are in your innermost essence as Atman, as this thou, art that which is all things. 3 verses from the Kina Upanishad describe this worldview better than any I know in the beautiful poetic translation of Sri Aurobindo early in his Oxford years. You can't read these with your logical mind. They force you to a different place. Watch what happens. That which thinks not by the mind, that by which the mind is thought, know that to be the Brahman, and not this which men follow after here. That which sees not with the eye, that by which one sees the eyes seeing, know that to be the Brahman, and not this which men follow after here. And finally, for all yoga practitioners, that which breathes not with the breath, that by which the life breath is led forward in its paths, know that to be the Brahman, and not that which men follow after here. Fantastic set of texts to meditate on, to unify with the practice of the asanas, positions, and whatever your practice is, the two working harmoniously, like the melding of mind and body, with a similar outcome in the end. What is beautiful about yoga is that this melding, right, remember the Sanskrit word, root, yuj, to bind or yoke together. This binding, this uniting together of seemingly disparate things in yoga practice. The uniting of the visible and the invisible, the appearance and the Brahman, the ground. This can work in multiple contexts, even for those who have no theistic leanings whatsoever. You don't need to use the words Atman and Brahman to recognize the goal that the Kina Upanishad is describing. Think, for example, of two other ways that this unification can occur. The unification of the mind or self within itself in attaining meditative concentration or samadhi. The calming of the mind that Rael talked about. The beginning with this flittering multiplicity that is our ordinary consciousness, and settling down to a highly coherent state. That's a form of yuj, of binding. And next, finally, think of the binding together, the unification of body and mind, the mind-body unity. Overcoming the ignorance of the body, that denial that we students and professors often lose ourselves in. Or overcoming the unawareness of the conscious self, which is always with us. Or even setting the powers of the psyche free to reintegrate with the body. Powers which often have positive therapeutic consequences for bodies that are ill or stressed. All of these lie in that core Sanskrit notion, yuj, this binding together in the end. The Yoga Shika Upanishad offers beautiful reflections on the nature of yoga. These are some of the earliest texts describing yoga. It said, I'll move to the English, it said that in the sound ha, 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 the sun is contained, and in the sound sa, sa, the moon. Hatha yoga means uniting of sun and moon. Again, this theme of uniting that which appears to be different
in a non-dual way of thinking that transcends the logical mind, non-dual or Advaita understanding of reality. Soham, I am it, recited this way, is called mantra yoga. Through understanding of the mantra yoga, the yogi will be directly born unto the path of liberation. Here again is this call to move from the practice and what it teaches you in an immediate way to a level of understanding. And finally, when the unity is perfected, the changeable or chitta in the human being is absorbed into the absolute or Brahma, the goal of Laya Yoga will be reached through the resulting rest, the rest of the life force, prana. The union with whatever you want to call the ground of us and of our experience. This is the common feature. People often ask me, so what if I can't make heads or tails of God or Brahman or these ancient terms? What if I want to treat them as metaphors, treat them metaphorically in my practice? Am I excluded from this framework out of which yoga grew? And the answer is no, you are not excluded. It may be problematic in your local evangelical Christian church to say, I treat God as a mere metaphor for the goodness of human nature. I mean, that might not go over well, but it's actually not a problem in the practice of yoga. You say, I don't treat any of this language literally. And every sadhu says, well, of course not. How could you possibly treat it literally? Then he, being indifferent to all objects of desire, is said to be devoted. And now the metaphor. As a light standing in a windowless place flickers not. Beautiful. That is declared to be the parallel for a devotee, whose mind is restrained and who devotes himself to abstraction. Here, consciousness becomes like an unflickering light. And that, ladies and gentlemen, I suggest, is by itself a goal of practice. I suggest that the background helps you achieve and understand that goal. But the goal of an unflickering consciousness and a focused self is an intrinsic good, not merely a means to some other end. And I actually would suggest it can only be achieved when one pursues it as a good in itself and not as a means. If you instrumentalize your yoga practice, you keep yourself at the lowest stages. If you allow that practice, that state of being, to be a value in and of itself, consciousness as an unflickering light, then the practice expands and grows. If we had time, I would talk about the particular features of the Yoga Sutra. You can, to place in context the understanding of practice today, you can sort of skim them. I highlighted the first four. Again, this word yuga, union, the binding together of that which is different, that standpoint of Advaita, maybe analogous to Tao, if some of you have studied the Taoist texts, Lao Tzu, where the complementarities are seen not as contradictions, but as pieces or parts of the one Tao, the one way that we're all launched upon. The positive effects are emphasized in the Yoga Sutra. The avoiding of negatives, as listed in 130, for example, are surpassed. But let's just consider the bottom there. The mastery of one in union extends from the finest atomic particle to the greatest infinity. That same unity applies to all levels of reality, individually and with each other. And in that beautiful closing sentence of the first book, principle, when the agitations of the mind are under control, again, a beautiful metaphor, the mind becomes like a transparent crystal and has the power of becoming whatever form is presented, knower, act of knowing, or what is known. That's that flexibility of that unified and focused consciousness. I close with just 2 slides to people who think in this tradition, think out of that tradition of Vedanta, think of the nature of Dharma pursued for the sake of Dharma alone, as it's often put. Vivekananda, since it's his chair that modified, I just have to show you. We can't talk him through. But I want you to realize that the 8-limb path of yoga, the whole system is far more than just the position that you might practice in your yoga class. You have the 8 different paths, and then they themselves are understood as stacking upward like a staircase. So that the achievement of one leads to another, leads to another. So often we seem to make it 3 stairs up, maybe 4, and then we're done. Right? And there's that potential. You're only halfway there. And not to see that it's a part of a ladder, and that the end, samadhi, pulls you toward it without conscious striving, is the full picture. In conclusion, then, Vivekananda, with a theistic understanding here of the goal of yoga. He says the sum total of the intelligence displayed in the universe must therefore be the involved universal intelligence unfolding itself. It's that action that the yoga practitioner is caught up in as she sits and practices. This universal intelligence, Vivekananda says, is what we call God. Call it by any other name, I don't care. It is absolutely certain that in the beginning there is that infinite cosmic intelligence. Contrast that with Sri Aurobindo, who describes it here slightly differently. Out of the heart of mind-body unity and spiritual evolution. He says there's no reason why life should evolve out of material elements or mind out of living form unless we accept the Vedantic solution that life is already involved in matter and matter in life. Without that presupposition, the practice that we know of mind-body connection doesn't make sense. If you have the view, there's a UC neuroscientist who says, wires and chemicals, that's all we are, wires and chemicals. If that's your metaphysic, you cannot make sense of the experience of even the beginning practitioner, of that blending of body and consciousness together. Because in essence, matter is a form of veiled life, and life a form of veiled consciousness. So that Sri Aurobindo concludes to speak of this evolutionary process of life and matter, the process moving on and on, none of it making sense unless we accept this solution that, again, matter is a form of veiled life, and life a form of veiled consciousness. Best wishes in your practice and your application of yoga. Thank you very much. But you're also human beings with stomachs which are empty. So I'll be brief and let you quickly get on to the food. Yes, please. You know me too well. Purushotama.
Not having a God or seeing God as a metaphor, but it goes a little further than that. There are groups, and it's just come to light more recently too, that a Latino group, a Christian group, wants to practice yoga, meditation, and so forth, and because it ties in with what how they view their Catholicism and so forth, but the church comes down very strongly and says, no, you can't do that. Yoga is the work of the Satan and the devil and so forth. So how would you counter that? I mean, consider Satan to be a metaphor in this case, or the adversary, or an insurgent, or terrorist, perhaps, as well.
Purushotama, you're being wicked. I would say this to my Catholic or conservative evangelical friend. I would say, you teach that God is the source of all things. Therefore, everything true must be compatible with your God. If God excludes something true, your God is not actually God. Now, humans have discovered some things about how the human person works. These discoveries go back thousands and thousands of years and were practiced and experimented with in the tradition of yoga. Those truths cannot be thought away, and if your metaphysics excludes true and fundamental principles of the kind of persons that we are as matter and as consciousness, then it's your theology that suffers, not the ancient practices. And then I might say, sure, at some point we will conflict, because the yoga presupposes a pantheism or panentheism that is at home to and sponsors and vivifies that practice. And your particular view may have a God much more separate from that world. But shall we practice together? Come, let us sit. And find out, as you practice deeper, that overcoming of difference and that deeper union, whether you don't find yourself in need not just of a transcendent notion of God, but of the immanent divine, which the Hindu sacred texts have taught as well. Yeah, yeah, right. Om is fantastic because it's a word which is not a word, the wordness of which is evaporated by the performing of the Om. The Om is merely drawing attention to the breath itself. And the forming of the lips, the exhale, and then the Im, the long, lasting exhale of the breath, merely draws your attention back, as Ariel said, to here, now, this second, this breath of which you are constituted. But it asks you at the same time, by identifying the opening of the lip for the and the closing of the breath with the, it asks you to recognize the breath not as separate, as an atom, as an individual moment or substance separating you from all other things, but to recognize that your breath is your breath, and your breath is indeed all breaths, is indeed the universal breath, which is Brahman, and not that which men are seeking after here.
Where is the soul lies in the atmosphere?
Where's the soul in the atmosphere? Yes, well, I think we should turn to the Western philosophers. The so-called father of modern philosophy, Descartes, actually located the soul. He said we exist as soul and as body, so good so far, but they're absolutely separate kinds of things. From a Hindu perspective, awful. And we've got to find a point where they can interact. So he said, well, there's a gland back there in the back of the brain called the pineal gland. I don't know what it does, so we'll say that's where the body and the soul talk to each other. It really makes you want to read the Upanishads again. Because in the Hindu tradition is the belief that soul permeates. To locate it in one spot, as Descartes did, or the body in another spot, would be to separate. All right, there are places in practice where we rise up through chakras, but that's not dualism. That's a spiritual progression, in my view. Please. Yeah, we're almost done. I'm watching the audience. I can tell the student corner is the hungriest. They burn more calories. So I will not push them beyond their limits. Maybe last question, Rita? Is it okay? Last question.
The question is that the building blocks of yoga practice.
Just speak really loud because it's not working anyway.
Suggests that it's these higher stages often are dependent on the lower stages, but these stages is a very involved practice that maybe not everyone has time or ready to do. How might that be more accessible for
Yeah, so that's why I put on the, see if we can do it here, this picture which gave you the sense of the whole realm in a circle. And really, my appeal today was a very simple one. It was the appeal not just to take the practice by itself, but to allow yourself, you know how Gandhi spoke of experiments with truth? To allow yourself to experiment with combining your practice with that pursuit of knowledge, or of karma, of good deeds, of duty, or of bhakti, of devotion. And even little experiments where bits of this entire world become richly integrated with your practice, I believe you will find it transforms your practice. Some of you practice for yourself, for your spiritual quest, and some practice with others for therapeutic and medical benefit. In either case, the understanding of a little of this world enhances. So how do you take this picture, which is a static circle, and this picture, which is steps, and integrate them? The spiral. And I ask you to think of yoga as a spiral of practice and understanding, of sitting and comprehending, as you move deeper and deeper, both in your unity and your connection with others. Thank you very much.
Thank you so much, Professor Clayton. His range of understanding of metaphysics, of religious traditions, spans pretty much every religious tradition that known to man, known to persons. So it's really remarkable, not just the breadth of his knowledge, but the depth. And what I wanted to particularly thank him for is regrounding where these traditions that we now practice as complementary and alternative medicine arise out of, and where they could go if we did not deracinate them, did not cut off their roots when we practiced them. Thank you so much, Professor Clayton.